Okay, so our 2 minutes is up. So first thing we're gonna do is we're gonna have the patient open up. We're gonna take the impression off. And our temporary crown is now on the tooth. So what is the percentage, Rachel, would you say that the temporary stays on the tooth or comes out in the impression?
Usually, most of the times, the temporary will stay on the tooth.
Okay.
Unless you pull out the impression before 2 minutes. But then you run the risk of the temporary crown material not being completely set.
Okay, and then it could be more brittle.
Yes.
Okay. So if it is set, then it's going to stay on the tooth. So now what we use to get the temporary off are the hemostats. So you're just going to grab firm grip on the temporary, just wiggle back and forth. So these typically, they're not sharp. You can see they have more of like a rounded edge. So you can see we have a little extra material. That's common with the Typodont. So now what we have to do is trim this up, get it nice and smooth, nice and even. You can peel off the extra material. Usually it just flakes off around the margins of the temporary, which is nice.
So the one thing you want to be aware of when you're adjusting your temporary is the margin. And that is this line right here. I know it may be a little bit hard to see. But this line, you want to make sure you don't adjust that line.
Because you still need to have full coverage on the tooth in the mouth, or the patient's going to have sensitivity. They're going to get food trapped along the margin if it's not covering the tooth to the gum line. So now we are using the Slow Speed handpiece. We have a mandrel and we have a sandpaper disc. Is this more of a coarse one?
Yes.
Okay, so she's
This one is
using
a little
coarse.
bit more coarse.
Okay, so it has a higher grit. And that way it's able to take more off faster to save time.
And I always adjust my crowns like this because this can also help you protect the margin and not over adjust. As if you're holding it like this, you're going down and it's harder to protect the margin.
Okay. You always want a fulcrum, so see how she's using her finger here to establish a fulcrum, so it's not just like free floating in the air.
And you just gently adjust to remove any extra temporary material that you may have. This area that I just hopped over is the contact. That is one thing you want to try not to touch because this is going to keep the tooth in front and the tooth from behind to shift in towards the temporary. Because then once the permanent crown comes in, you're going to have to adjust it a lot more in the contact area because the tooth in front or the tooth behind have moved. So you just want to barely touch that area.
More just a quick smooth versus removing a lot of material.
In this area right here, I'm adjusting because if there's too much temporary material, it can cause the patient difficulties to floss. So you just want to make it nice and smooth so the floss can just kind of slide through.
And we don't want any gum irritations because that's going to cause inflammation, gingivitis. Then when the patient comes back to have their permanent crown seated, we may have issues with bleeding, isolating the tooth, keeping it dry. So that just makes it harder for the dentist.
That looks good. So now I'm going to start adjusting the bite. Just from the get-go, I always take a little bit away from the bite just because you want the temporary crown to be completely out of occlusion so the patient is not biting on it because that can cause the tooth to become sensitive as well.
So as you can see the dust here, so Rachel is wearing a mask while she's adjusting. You can see the dust coming off the temporary, so you do want to protect yourself. Obviously the patient is in the chair as well, so this is in the patient's mouth, so we want to have our proper PPE on.
So now once you feel like you've gotten to a good point where everything feels smooth and the margin is clean, there's no extra temporary crown material, what you're going to do is you're going to start to check occlusion. You also want to make sure the margin is completely closed. So you see here is a little open. That is telling you that you may have to adjust the inside a little bit more.
The interproximal, so that it seats down a little further.
And then just looking at it, you can tell right here how thick it is in that area, and that's the area that you would want to adjust a little bit more. You can see now that I adjusted it, the crown is completely seated. So if you feel like your crown doesn't seat all the way, you can always take a little bit more into proximal from the front or the back. We're gonna check, put it back on so we can check the occlusion.
Okay, so we're going to use the articulating paper here.
And you have the patient tap, 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 so close up and down a couple of times and then grind. So you guys can see I'm getting one blue mark, so that means the patient is hitting in that particular area first. So you would take it off and adjust it a little bit more in that specific area. So we go check right again. Tap, 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 and grind. Still, you see, still a blue mark, but it's getting lighter every time you adjust it.